oversight visit to the province and will visit a few COVID-19 facilities across the province and sit down with the provincial and district management and attempt to get, a better understanding in terms of the challenges that this province is currently facing. Do we have Jayed-Leigh? All right, let's go live to Jayed-Leigh, who's covering the story first. Jayed-Leigh, what are you witnessing there?
I do not wish to back at home. We are at Nie-meyer Hospital in Utrecht, where the minister is currently doing his oversight visit. At this particular hospital in Utrecht, it is a newly developed hospital building with several beds ready to cater for COVID-19 patients. I'm just going to ask my cameraman Nati just to walk with me so we can see the minister engaging with some of the medical personnel as well as the authorities on the ground, and just getting a sense of what exactly is happening at the hospital.
So by the time we made that request, they were done with the facility.
The minister walking there with the health MEC Nomagugu Simelane Zulu, who is also showing him the various rooms inside this particular hospital that has been revamped just to help assist with the influx of COVID-19 patients. Yesterday, the minister was also at several of the Durban hospitals, also walking about and viewing the state of readiness. As you know, we are hitting the peak lane in KwaZulu-Natal, with stark revelations coming from the minister saying that KZN could possibly surpass Gauteng as well as the Western Cape in the coming weeks.
We needed to save space. So where's your isolation?
We are heading now to an isolation room. MEC Nomagugu Simelane just explaining to the minister what exactly is happening here. This is one of the ICU rooms.
Yes. That was the plan.
Okay.
The one that's inside and the other one inside.
No, it's not the tank now. The tank is still on the ground. They called to say they need to check the spaces where they're going to put the tank, but they do have the medical gas cylinders that is built on the other side.
So by the time this is complete, the tank will be installed?
Yes.
Okay. All right. No, that's fine. I think that's good. These are the
The trial is
The minister has been in KZN just doing oversight visits, and he will move on from this hospital and go to Newcastle, to Madadeni Hospital, where he will be also conducting an oversight visit. And many people have been asking, why these particular hospitals? Well, these are said to be the hotspots here in KwaZulu-Natal. Just spending some time on the ground, many people are saying that this is where the highest rate of infections are occurring, including in the northern parts of KwaZulu-Natal, such as Zululand, where several people have said that their loved ones have been infected with COVID-19 and they need dire clinics in that particular area, such as hospitals. So the minister really just coming to KwaZulu-Natal to see what exactly has been done on the ground, and if there is indeed enough PPEs in hospitals, if the medical staff and personnel are indeed happy with what is happening on the ground, are they receiving support, and also any challenges that they may face on the ground as well. Let's listen in. Okay, the media has just been asked not to record this as they are discussing some matters that we should not be listening into. From here, Blaine, the Minister will move on to Newcastle, where he'll be doing his oversight visit there.
Maybe we can engage. I just want to get a sense of what we're talking about in KwaZulu-Natal, some of the numbers that we're getting now, over 90,000 in terms of cumulative cases. KwaZulu-Natal recording over 1,000 fatalities. The Minister yesterday was saying that the reason why we're not getting zero infection, and he gave an example of two provinces, which is the Eastern Cape and the Western Cape, is that there's still many people that are not following the health and safety protocols in terms of the wearing of masks, for example, which is key. What's the situation where you are in terms of this, Jayed-Leigh? I mean, as we say, we're approaching this peak in the province of KwaZulu-Natal. How do they know that's the peak? Well, they get all the relative data in terms of the numbers, they punch it in to these models, and they can, I guess, work it out when the peak is going to hit. But what's the situation with regards to people adhering to safety protocols there?
That's a very good question, Blaine. You know, we spent most of our time in Zululand last week, myself and my colleague Butle Kumalo, just traveling in that terrain and asking people, are they receiving support, those people in the rural areas? And many are saying that they still need clinics in the area, they still need hospitals that cater for people in the most rural areas of KwaZulu-Natal, where there aren't exactly institutions that are set up for those patients who've got COVID-19, and some even saying that their loved ones are dying at home. We spoke to one elderly man who said that his son died at home, and it was only days later that they found out that he actually did die of COVID-19. So when you're looking at KwaZulu-Natal and you're looking at the most rural parts of the province, there is still much that needs to be done with healthcare facilities in those in those parts of the province. But here in the urban areas of KZN, especially in Durban, there seems to be a lot of support. Speaking to the MEC, she says that she's visiting these facilities weekly, trying to ensure that medical personnel, doctors, authorities are receiving the support that they need in terms to fight this pandemic. It is uncharted territory, and they're trying to do as much as they can. But the minister saying yesterday in his oversight visit in those two hospitals, in Claywood Hospital, just saying that, as it stands right now, there is a concern with KZN surpassing the Western Cape, surpassing Gauteng, and really looking into the province, making sure that the facilities are jacked up. As you can see where we are right now, this is a newly revamped hospital here in Utrecht that's going to cater for patients who need isolation, as well as those who need to be quarantined. And the minister also just walking about, looking at this new facility, making sure that everyone on the ground is happy with what they're doing, and also trying to establish what the concerns are and the challenges here in KZN. We saw just 2 days ago a video went viral on social media of a lady saying that her father had succumbed to COVID-19 in a makeshift hospital here in KZN, and that was one of the biggest stories that the province saw. And the minister also visited that makeshift hospital to see what exactly went wrong. Now, the media weren't privy to that information, where he engaged with the MEC and authorities on the ground, but there is an investigation that is underway, and I'm sure they'll get to the bottom of that situation, an incident that occurred at that hospital. Let's try and listen in and hear what exactly is happening and what the authorities on the ground are telling the minister.
Up front, and it is a specialized work.
All right, let's move on.
I'm going to
All right,
Okay, Blaine, I'm
Jayed-Leigh.
going to hand back to you.
No, that's
Authorities
fine.
are saying that the minister is engaging with, those on the ground, and this is not privy for the media. So we're going to try and speak to the minister and pose these questions directly to him once we get to Newcastle. I'm going to hand back to you.
Jayed-Leigh, thank you very much indeed. Yeah, yesterday the minister as well encouraging people to go to hospitals for basic services like immunizations, contraceptives in terms of family planning, also in terms of chronic diseases, heart diseases, diabetes, checking your blood pressure as well. The worry is that you might have a scenario where you fear to go to the hospital and then you're not adequately taken care of at home, you die. So you might have a scenario where you get an increase in terms of fatalities, not as a direct link to COVID-19, but what COVID-19 has done in terms of the disruption of healthcare facilities in many parts of the country, the fear of going to hospital. So the minister encouraging people to seek treatment if they need it. So Jayed-Leigh Paulse, they're monitoring the situation. We'll go back to her in a short while. I want to get now to the Eastern Cape.